Info for patient.
Situation where you experience a bilateral response. First thing is that likely there is a possibility of a lesion on the. Secondly, there are certain situations where you get a bilateral response which is rather equal. So right side पे भी उतना ही response आ रहा है, left side पे भी उतना response आ रहा है. If the dizziness is very severe and acute kind of stage, then the response is certainly even more on the contralateral side. But a bilateral response, a kind of minor feeling of dizziness, comes in 2 or 3 situations. One is खुर्शीद साहब ने जो mention किया, मैं उसको बहुत over emphasize करूँगा, and that is anxiety associated dizziness. So important and so common. Yeah, exactly. So you get a bilateral response if there is a anxiety associated. Secondly, sometimes due to migraine, you get a bilateral response. Sometimes, not always. Sometimes. Okay. Migraine का जो dizziness है, it almost always presents like BPPV. And third thing, don't forget that alcoholism is gaining more popularity in Pakistan now, unfortunately. खास तौर से जो chronic alcoholics हैं, they can get this kind of response. So ये 3 चीज़ें ज़रा ध्यान में रखें और ये इससे आपको ये positive response आ सकता है. I have yet to see kind of a patient जिनको कि pure cervical वो type, pure cervical.
I agree with you. I've also never seen a pure one.
इतना ज़्यादा emphasize किया जाता है हर patient को, जो है वो उसके cervical spine के X-ray हो रहे हैं, उनकी treatment हो रही है, उनकी orthopedic देख रहे हैं, उनको neurosurgeon देख रहे हैं.
Actually anxiety होती है जो cervical का होता है. And coming back to Khalid Chima's question, 5% I see it bilateral also. And the very interesting thing, initially I was confused which side to do and how to, but I've seen almost if you do one side, for some reason the other side also gets fixed. When I reviewed them after 1 week, and they're good. I mean, I asked them which side is the worst one. They would say, okay, right side. I would do the right side, please.
Right.
And the patient, both sides will improve. Very rarely I have to do the other side after 2 weeks or.
Do you do